When you sit in that dental chair, you probably focus on the dentist, right? But what if I told you the real magic often happens just out of frame? Dr. Esma, today we are exposing the hidden world of the assistant dentist. The fast hands, the silent signals, the split-second decisions patients never notice. Are they just passing tools, or are they secretly running the entire show?
Rasim, I love this already. Most people have no idea how much responsibility an assistant dentist carries. Infection control, patient comfort, anticipating every move before I even ask. If we are not perfectly in sync, the whole appointment feels different.
So you are saying there is a silent choreography happening every single time?
Exactly. And once you see it, you will never look at a dental visit the same way again.
Okay, Dr. Esma, let us talk about real life. You know that moment when a patient walks in already anxious, gripping the chair, heart racing? Most people think the dentist fixes that fear, but is the assistant dentist actually the first line of defense?
Absolutely, Rasim. The assistant dentist often notices the tiny details first. Shaky breathing, clenched fists, avoiding eye contact. While I prepare clinically, they are building emotional safety. A calm explanation, a reassuring tone, even adjusting the chair slowly can change the entire experience.
So when something feels smooth and effortless, that is not luck. That is preparation happening behind the scenes.
Exactly. Sterilization timing, instrument setup, suction control, monitoring comfort. If even one step is off, patients feel it instantly.
Wow, so the difference between stressful and seamless might come down to the assistant dentist. Dr. Esma, this is bigger than I thought. We are not just talking about comfort, we are talking about outcomes. If the assistant dentist anticipates your move during a complex procedure, that saves seconds. And in dentistry, seconds matter, right?
Exactly, Razim. When the assistant dentist positions suction perfectly, keeps the field dry, and prepares the next instrument before I ask, it reduces procedure time and improves precision. That means less strain for the patient and more accurate results.
So the patient might think that was quick and easy without realizing an entire support system made it possible.
Yes, even post-treatment instructions, scheduling, and follow-up calls often come from the assistant dentist. That continuity builds trust and better healing.
Wow, behind every confident smile there might be an assistant dentist making sure everything goes right. Dr. Esma, give us some background. How does someone even become an assistant dentist? Are we talking about a short course or serious training that most people underestimate?
Razim, it is serious training. Many assistant dentists complete certified programs covering anatomy, radiography, sterilization protocols, and chairside techniques. In some clinics, assistants take dozens of dental x-rays every week and manage strict infection control standards daily.
So they are not just helping, they are clinically skilled professionals.
Exactly. I remember a complex procedure where my assistant noticed a tiny equipment issue before it became a real problem. That quick reaction prevented delays and kept the patient comfortable.
That one small action can change the entire experience. Dr. Esma, let us go deeper. From a scientific perspective, how does an assistant dentist actually improve clinical performance? Is there real evidence behind this teamwork, or is it just tradition?
Great question, Rasim. Dentistry is built on precision and ergonomics. When an assistant dentist uses four-handed dentistry techniques, we reduce unnecessary movement, maintain a clear field of vision, and improve posture. That decreases fatigue and increases accuracy. Studies on clinical efficiency show that coordinated chairside support shortens procedure time and enhances patient safety.
So it is not just smoother, it is measurably better.
Exactly. Better visibility, controlled moisture, reduced contamination risk. All of that contributes to more predictable healing and long-term success.
Now that sounds like serious science happening behind the scenes. Alright, Dr. Esma, let us make this practical. If someone is choosing a clinic, how can they tell whether the assistant dentist is truly part of a strong team?
Great point, Razim. Step 1. Observe communication. A skilled assistant dentist anticipates instruments without verbal cues. Step 2. Notice patient preparation. They explain the process clearly and check comfort before we begin. Step 3. Watch infection control. Gloves, masks, surface disinfection, and sterile packaging should be handled confidently and consistently.
So patients can actually see the quality in action.
Exactly. Finally, pay attention after treatment. A dedicated assistant dentist reviews aftercare step by step and ensures you leave feeling informed, not confused.
That is a clear roadmap. Now people know what to look for. Alright, Dr. Esma, let us talk warnings. What are the red flags patients should never ignore when it comes to an assistant dentist?
Great question, Razim. First, do not ignore disorganization. If instruments look scattered or sterile packages are opened too early, that is a concern. Second, do not overlook poor communication. An assistant dentist should explain what is happening, not leave you guessing. And never hesitate to ask about hygiene protocols.
So patients should speak up if something feels off?
Absolutely. Do ask questions. Do observe teamwork. Do notice whether the assistant dentist checks your comfort regularly. A confident team welcomes transparency.
That is empowering. Knowledge turns anxiety into control.